here before then. I do want to, I'll thank her again if she comes in the room, but I want you all to know how incredibly supportive she has been in getting this bill to the floor and how deeply grateful I am to her for her leadership in recognizing this as a critical issue for the South Asian American community that will also benefit the entire community that has heart disease. So I want to say thank you to her. I also want to thank my Republican co-lead, Congressman Joe Wilson, for his support. And he has been a sponsor of the bill with me since I introduced it a couple of years ago. And I'm really proud that we got 18 Republicans on the bill yesterday. This is an issue that affects every single district across the country. And it was really great to have such a big bipartisan vote as we go into the Senate. I already said a thank you to Congresswoman Chu, but I want to say another one because it really having the backing of KPAC for this bill and having her specific advocacy, her respected leadership. She's been a friend, a mentor, a guide for so many of us, and such a fierce advocate for the Asian American, Native Hawaiian, Pacific Islander community. So thank you, Judy, for everything that you have done just broadly and also, of course, for the bill. Also, I just cannot go without saying that I have to thank our doctors, our advocates, our validators, our community members who have all spoken out on this bill, and who, people who have been affected by heart disease and are speaking up and saying we need to lift this up in our own communities. We need to really be talking about this so that people understand this is a real issue for our community. Now, I know that when I became the first South Asian American woman in the United States House of Representatives, I really believed that it would give me the opportunity to bring a different perspective to bear at the table on our policy. I believed it would give me the opportunity to lift up issues that are specific to our community and to make sure that we're addressing them. And that has never felt more true than this week. It was 2017 when the mother of my then legislative director, Ven Narala, who still works here on the Hill, died suddenly and tragically of heart failure. And when we started to look into it, how could this be? How could she have passed away? She was so healthy. She had a very healthy diet. She didn't suffer from many of the symptoms that we sometimes think of, the conditions that we think of. And it was then that we did the research and found out that South Asians are 4 times more likely to develop heart disease than the general population. 4 times. It is really a devastating disease that is ravaging our community, and honestly, most don't even know about their increased risk. And we're so happy to be joined by Congressman Aapi as well, who I'm proud to serve with and is one of our 4 South Asian American members here in the House. So knowledge is power, and this bipartisan bill will increase understanding and awareness of heart disease among the South Asian community and give South Asian Americans the tools to better manage their health. And we hope that it could ultimately lead to the discovery of a new drug that will help patients, all patients, not just South Asian Americans, to survive heart disease. So there's no doubt in my mind that this bill will help save lives. But you don't have to take my word for it. You're going to hear later on from some of our speakers who are themselves members of the medical community on how crucial this bill will be in preventing needless deaths. Ven's mom would have turned 80 this year. And his family is just one of millions who have lost a loved one to heart disease. So by passing this bill, we're not only preventing deaths within the South Asian community, but we're also increasing awareness and understanding of cardiovascular disease that will benefit the health and the well-being of every community. I am so proud that we passed this bill out of the House with tremendous bipartisan support. I've already spoken to Leader Schumer about bringing this bill forward in the Senate. I spoke to the White House about it yesterday. I figured we should take this momentum and try to push as hard as we can to bring it quickly to the floor. Now, I know that the Speaker is going to join us at some point here, but let me turn it over now to the one and the only Representative Judy Chu, the chair of the Congressional Asian Pacific American Caucus.
Well, thank you so much, Pramila. I'm Congressmember Judy Chu, chair of the Congressional Asian Pacific American Caucus, or what we call KPAC. And I am so thrilled to join Representatives Pramila Jayapal and Joe Wilson in celebrating the passage of the bipartisan South Asian Heart Health Awareness Research Act. I am so proud that I was able to cast a yes vote on this CAPAC-endorsed bill. This critical legislation is not only going to raise awareness about the prevalence of heart disease in the South Asian community, but it will also save lives. And I have to give so much praise to Representative Pramila Jayapal for envisioning this bill, for being so persistent in this bill, and making sure that it came to a reality. It is because of her that we now have this awareness around Capitol Hill about the problems pertaining to South Asian heart awareness. And also, huge thanks to Speaker Pelosi, because in a time when there was so much competition to get bills on the floor this last week, she was the one that made it happen. So I am so thrilled that we are at this place because we know that communities of color already face increased challenges when it comes to accessing health care, from language barriers, health stigmas, to a lack of data surrounding AANHPI health and the rise in anti-Asian rhetoric and violence. It's clear we have to do more to ensure that every American, regardless of race, ethnicity, or socioeconomic status, can access the appropriate care, not only for treatment, but for prevention as well. The lack of research into just how detrimental diseases such as cardiovascular ones are to our communities is not only harmful, but disgraceful. South Asians in the U.S. have 4 times the risk of heart disease compared to the general population, and a much greater chance of a heart attack before age 50. The factors, however, behind this are not well understood. And so preventative measures are just rarely shared. So we need to have greater understanding and awareness of the disproportionate effects of this disease, and that information will greatly help not only South Asians, but patients of all races and ethnicities. That's why I was so honored to co-sponsor this bill and ensure that we took the necessary steps to raise awareness and reverse these frightening trends. By creating these heart health promotion grants at the Center for Disease Control, we will be able to further research into how cardiovascular diseases are disproportionately impacting these communities, and we are making sure that there will be healthier outcomes for future generations. So now it's the Senate's turn to act, and South Asian American communities in every corner of our nation are able to, once they act, reap the benefits of increased reporting, research, and the subsequent data that will be collected. And now we will be able to protect vulnerable communities and save lives. So I'm very eager to see the positive benefits that this legislation will bring to us in the days ahead. I want to thank fellow CAPAC member Congresswoman Jayapal again for her vision, for her passion, and for her leadership. And I can't wait to see this bill signed into law.
Thank you so much, Judy. And now there's another person that's been very helpful to us in moving this bill along, and that is the wonderful chair of the Energy and Commerce Committee, within whose committee this bill resided. And it wouldn't have moved if Frank Pallone hadn't helped it to move. So, Frank Pallone, thank you so much for your leadership.
Thank you, Pramila. Judy talked about your persistence, and I wrote that down because I don't think anybody's more persistent than Pramila. It's her persistence that made this possible to get out of committee and to the floor. But I just appreciate the fact that she was so persistent in making us all aware of this disproportionate problem, if you will, the South Asian community. Many of you know, I always tell everybody I have more South Asians than anybody, but I can't really prove it. So I just say it, you know. But I do. I have a very large community of Indian Americans, Americans from Pakistan, Sri Lanka, Bangladesh. And if you come to my district in either Edison or Woodbridge, you would realize it right away. And many of them have talked to me over the years about the problem with heart health and the disproportionate. I have this one statistic, of course, this is in the world, but it says while South Asians comprise 23% of the world's population, they carry approximately 60% of the world's global burden of heart disease, which is incredible. And that's, you know, true disproportionately here in the U.S. as well. But I just want to say two things also that Pramila mentioned to me. First of all, the data, right? We really have to have the data. And as Judy said, you know, this talks about research, this is about awareness, this is grants for all that. But we really need the data because we don't have it. And regardless of what anybody tells you, we really don't. And that's one of the things that is going to be very important about this bill. And the other thing that Pramila mentioned to me the other day when we were on the floor, which I came in late, so I don't know if she said it, is that, you know, I always said that, she said that a lot of times people don't, South Asians don't get diagnosed because they don't seem to have the signs of heart disease. So, for example, you know, I associate heart disease oftentimes with being overweight or obesity, right? Most of the South Asians I know are pretty thin. And so I could see how, you know, you wouldn't think automatically that there's a problem and therefore maybe you don't go in and you don't find out that you have a heart problem when in fact you do. So these are the kinds of things that need to be, it's both an awareness to the community itself as to, you know, that maybe you should be more aware of this because of the disproportionate problem, but at the same time to make professionals and healthcare providers aware as well. So that's why this is so important. And we are going to work on that other body and get this thing passed before the end of the year. So thank you again.
Wonderful.
Thank you. This is.
Thank you so much, Frank. I know we have next on our speaking program a number of our community advocates, but I just wanted to give a chance to Congressman Bera to say a minute if you'd like to, because you are our South Asian doctor in the House as well. And you've been the first of the rest of us, so please.
Not at all. Pramila is the engine that drives the South Asian members of Congress. So hats off to her tenacity and her leadership on this issue. And I'll keep my comment short, but I'll put my doctor hat on. The reason why this is so important is, yes, we, you know, as someone who's been in academic medicine, we study cardiovascular disease, but we don't always do it in an inclusive way. So this bill will help us specifically look at the South Asian community, try to understand, you know, the genetics and everything else, and other specific reasons why South Asians have a higher degree of cardiovascular disease. And this is an important step for the South Asian community, but we've got to do that same thing for all communities of color, the broader AAPI community, making sure that when we do these clinical trials that they're very inclusive, that we're recruiting from a broad swath of our community and making sure that they're representative. So again, hats off to Congresswoman Jayapal's leadership on this initiative, long overdue, and, you know, we will all benefit, you know, in the South Asian community from this, and perhaps other communities will certainly benefit from what we discover and learn and how we address cardiovascular disease in our community. So again, thank you for your leadership.
Thank you so much, Ami. And now it takes a movement to move anything, and so I wanted to introduce my friend who heads up the organization Impact, who has been so invaluable to this whole process, really educating our community about the opportunity to engage in democracy and engage in policy. Neil Makija.
I want to first thank, of course, our first Indian American woman in Congress in history, Pramila Jayapal. She's been such an incredible inspiration to so many young people in our community and really across the country and in every community because of her ability to build coalitions, to push forward issues that otherwise might get ignored or forgotten. I also have to thank Congresswoman Chu for her incredible leadership of KPAC and building the coalition that helped get this to the vote, Congressman Pallone and Congressman Bera, who was a trailblazer as the first Indian American in quite a number of years. We wouldn't be here today with this bipartisan win without their dedicated leadership and devotion to the South Asian American community. Each one of them recognizes that our community matters and is part of the fabric of American life. Today's celebration is also a testament to the power and importance of our community's representation in public service. It's no coincidence, as I said, that Congresswoman Pramila Jayapal is the first Indian American woman in history in the U.S. Congress, and that we, for the first time, have a critical mass where we're able to advocate for issues that are affecting our community. Cardiovascular disease is personal to me, as it is to many South Asian Americans. One of my first memories, my earliest memories growing up, was trying to console my mother when she lost two of her brothers the same year, her oldest, who was 50, and her youngest, who was 36. And I'm turning 36 this year. When I think and I look to my wife and I tell her that I'm coming down to do this work, the first thing she says is, don't eat Shake Shack on the way home. The second is that I need to get blood work done. But really, what I appreciate about this leadership is how many people will be affected by this, because it's not just the 5 million South Asian Americans. It's actually all of those who may suffer from cardiovascular disease, because by studying our vulnerable population, we'll better understand it, and that's going to benefit the entire country. Most importantly, I also want to say that this is the first bill, as you recognize, that is specifically focused on issues facing the South Asian community, and it's the first time we have built this coalition that has pushed forward such an issue. And I think this is the first of many more to come. Many of you have heard, Congressman Bera, you worked with the Dreamers, children of their parents are H-1B holders who are on long-term visas. They age out of their dependent status and they can no longer stay in the United States. Certain issues like that would never really see the light of day unless we had representatives like the ones we have here who are ready to fight for every community. So I'm very excited to see those wins continue to happen, to see votes like the one we had actually on the Dreamers that put a solution or a fix, at least for now, in the NDAA most recently. But really, we're going to take this fight to the Senate so we can get these bills passed by the end of the year.
Thank you so much, Neil. Thank you for all the work that you do, and you're absolutely right. We're going to make sure we address the H-1B visa issue and so many others as well. Now it's a real pleasure to welcome Dr. Ravi Kohli, who is the president of the Association of American Physicians of Indian Origin and has been a wonderful champion on this bill. Dr. Kohli.
Thank you, Congresswoman Pramila Jayapal. I have a new name for you, Pramila Persistent Jayapal. And Chairman Frank Pallone, thank you for your support of all causes for Indian and South Asian. And I actually watched your video on last week's. You're wearing the seersucker jacket and persistently and very patiently explaining all the details why this is important. Even though CDC doesn't want to do it, you're insisting they should do it to kind of promote all the education and awareness, all the progress that we need to make. This is a small step, but I think we have big goals to achieve, and we can achieve. I also want to thank you for the Restore Hope for Mental Health. I'm a psychiatrist, and that also is very important. 988 suicide hotline and mental health hotline is coming on board, and it's very important. I'm Ravi Khali, president of AAPI, American Association of Physicians of Indian Origin, which represents 100,000 Indian physicians in this country, which make up about 10% of the physician population. And I have the privilege to be the president of this association. We do a lot of outreach programs to locally as well as internationally. And we have been championing this bill for many years. And of course, Congresswoman Pramila Jayapal has taken it as her core mission for a long time and accomplished it last time and again this time, and hopefully it'll go through the Senate. We sent to our 15,000 members a newsletter last week about your accomplishment, and we're going to send it again this week with some, hopefully, to kind of reach out to the senators as well to make it happen in the Senate. and it has to be signed by the President Biden so it can be implemented. I think we need to continuously, progressively work on these. Like many speakers have spoken, we're only 2 to 4% of the population of this country, but we have an enormous burden. It affects young people, very productive, very capable doctors, technicians, IT professionals, everybody. So it's an economic burden to lose those young people at such a young age for this disease. This can be stopped. We need to find the risk factors and preventive factors and do research. And we can challenge this problem and come up with solutions. We always done that. America is famous for finding problems and finding solutions to those problems. So we'll do it again with your leadership and with your persistence. And Congressman Chu, thank you for your support. And Neil, you've been working very hard on this behalf of many progressive causes. Thank you again. Thank you, Amit Rakbera. And I spoke to your brother one time. He's also a psychiatrist like me. Yes. And thank you again for having me here today.
Thank you so much. That's our Indian American community. Everyone knows everyone. Thank you so much, Dr. Kohli. And now let me turn it over to Dr. Rita Kuwahara, who is the National Vice Chair of the Policy and Advocacy Committee of the American Medical Women's Association. Please, Dr. Kuwahara.
And thank you, Congresswoman Jayapal, for all your leadership on the bill. Heart disease remains the leading cause of death in the United States, and addressing cardiovascular disease in the South Asian community represents an issue of health equity. As a primary care physician working every day to advocate for my patients, keep my patients as healthy as possible, and end our nation's health inequities, I have too often seen that our lack of research and awareness regarding early onset heart disease in the South Asian community has resulted in increased poor health outcomes and death, disproportionately affecting those of South Asian descent. Further, we have seen excessively high rates of heart disease among South Asian women, but we need more research to develop evidence-based interventions to address this. We also need to increase clinician and community awareness of high rates of heart disease in the South Asian community, and we must update clinical risk calculators so that we can accurately estimate heart disease risk among those of Asian descent. The House passage of the South Asian Heart Health Awareness and Research Act is historic, and we must move this bill forward in the Senate as an issue of health equity. Thank you.
Thank you so much, Dr. Kuwahara. And look who just walked into the room. Speaker Pelosi, I had given you tremendous praise at the very beginning, and I'm going to do it again because we simply could not have done this without you being able to bring this to the floor. We know this is a big day with the CHIPS bill passing in the House of Representatives, but I want to thank you for being so willing to lift up the issues of the South Asian American community and tell you that you've given hope to people across this country. And a lot of our young South Asian Americans are calling and saying, we've never seen a bill on South Asian American heart health in Congress before, and I have told every single one of them that we wouldn't have been able to do it without you. Speaker Nancy Pelosi.
Thank you very much. Well, I know so much has been said about this legislation. It's no use my going into the details of it, except that it meets the needs of the people. I want to thank Congresswoman Jayapal for her leadership on this, and Judy Chu, the chair of KPAT. Judy and Karen, they double-teamed on this in something we call crescendo. But let me make this point, and I thank all of you, every part of this, because, as I say over and over, inside maneuvering we can do so much. The outside mobilization makes the policy better. But this legislation right here, right now, that has been passed in the House is a real manifestation of the beautiful diversity of Congress. If we had not had Congresswoman Jayapal here to explain it, we didn't know. We did not know until she called to our attention just how different it was, the different impact on people from South Asia. So thank you, Congresswoman Jayapal. A real tribute to our speaking out for diversity in the Congress in so many ways. And Congresswoman, Madam Chair, Judy Chu, just bringing it up. When is it coming to the floor with the timetable and all the rest of that? So you know what the bill does. You know the testimony that has been given to it in terms of what it will mean in people's lives. We had the benefit of health professionals telling us why it's important, how it will make a difference, and again, our purpose to meet the needs of the people. But it would not have happened. And I take great pride in our caucus being over 70% women, people of color, and LGBTQ, and therefore our policy is better, more reflective of meeting all of the needs of the American people, and it passed with a nice vote on the floor of the House. So I'm honored to be here to be part of it, but I salute those who made it really made it possible. Thank you so much. Thank you.
Thank you so much, Madam Speaker. And we have one final speaker today, and then I hope we can get a picture with the speaker and with the group. And so I'd like to introduce Dr. Sudipta Devanath to please share with us your story as well. Thank you so much.
Thank you so much. Thank you, Congresswoman Jayapal, for sponsoring this bill and inviting me to share my story. Hi, I'm Dr. Devanath. I practice as a hospitalist in Norfolk, Virginia. 5 years ago, I was 4 weeks into my first year of medical residency when my uncle called me with words I would never forget. My mother had had a heart attack and was in the ICU. Where did this heart attack come from? Her cholesterol was normal, her blood pressure was normal. Regardless, they put 2 stents in her heart and she survived. We thought we were in the clear until the second year of my training, when her stents stopped working and she had to have open heart surgery. She survived yet again. My mother, Dr. Chinmoy Banerjee, a war refugee from Bangladesh who immigrated to this country and became a doctor working for the U.S. Navy, was almost taken away twice by heart disease. In my third and final year of training, heart disease struck again, this time taking away my stepdad, Dr. Arnold Banerjee, a Pakistani biochemistry professor with heart failure, leaving a hole in our family forever. What my family went through motivated me in my final months of training to become a hospitalist, where I could be on the front lines helping those with unstable heart conditions. Ultimately, though, helping patients survive acute conditions will not address how we can prevent these situations in the first place. That is where this bill comes in. South Asians have among the highest rates of heart attacks, heart disease, and contributing conditions like high cholesterol and diabetes. It is a problem that needs to be delved into on a deeper level and broader scale. This bill will help address a significant medical disparity for the South Asian community and others disproportionately affected by heart disease, hopefully keeping more hearts healthy and giving our communities more time to spend with their loved ones and make an impact on the society that we hold dearly. It was an honor to share my story and my family's story. I know that my stepdad is smiling down on us today. Thank you for helping us fight disease and disparity with your vote for the South Asian Heart Health Bill yesterday. Thank you for your time.
Thank you so much for that. I think rooting everything we do in people, because Democrats are for the people, and we had Ami Berra speak. We had Congresswoman Chu, and of course Chairman Pallone. We are so fortunate to have such a great leadership. So thank you again. Madam Speaker, this bill is also going to help our communities realize that engaging with democracy allows them to be heard and their issues to be addressed, and so it really gives so much hope across the country. So thank you all for being here, and let's do a quick photo with the speaker and make sure that we get everybody in here, and then we'll let everyone get on the way.
That was a beautiful story. I'm so sad.